Hello, I am Dr. Daniel Wu in Hong Kong. I welcome and congratulate you for having found this bunion talk. Bunion is a common but also the most misunderstood foot problem. What you are going to hear will likely be quite different from what you have read or heard before. For over a century, surgeons have believed bunion bones are deformed and could only be corrected by cutting them. But after trying dozens of different bone cutting techniques, patients and surgeons are still disappointed by their results. The reason is the real cause of the bunion deformity lies in the ligament, not the bone. All bunion feet have the same three distinct and constant features, like what you see here of the right foot, the tilting big toe, the protruding bunion bump, and the widened forefoot. For all bunion feet, the most critical event that has happened to them is the tilting and the shifting of the first metatarsal bone. It widens the forefoot and enlarges the bunion deformity, causing pain if shoes are not wide enough. It also collapses the big toe, rendering it powerless in walking. So, why the first metatarsal would shift in some feet is simply because the ligaments that are supposed to keep it in place are too weak to protect it from the daily stresses of walking. Ligaments are soft tissue structures keeping bones together. There are 28 bones in the foot, and they are held in place by more than 70 ligaments. Unfortunately, there are no supplements, medications, therapies, or exercises to help strengthen those weakened ligaments. There are no effective devices to protect the first metatarsal bone from being displaced either. Therefore, bunion is a progressive condition, albeit a slow process. It can only worsen with time unless one does not walk. It is also extremely important to realize that the displaced first metatarsal itself has always been normal and unchanged since its formation. Its displacement has little to do with itself, but with its incompetent ligaments. This understanding is especially relevant for proper and effective surgical treatment of bunion deformities later on. It has been widely speculated that bunion was caused by women wearing high-heel shoes, but most bunion patients never wore much high heels at all. A survey in 2010 of over 1,000 Hong Kong Chinese women found that heredity was a much more important factor than high heels. But if high heels are not responsible, then why most sufferers are female? It is because a female also differs from a male by having a different sex hormone of estrogen. Remember still that the bunion is a ligament problem, and estrogen happens to have a property of softening ligaments to facilitate baby delivery, and that's also conducive to bunion development in women. Bunion is not just an appearance and pain problem. but even more importantly, a functional problem. When the bunion deformity is bad enough, it will compromise the all-important mechanical power of the big toe for walking by making it more strenuous, tiring, and unstable. Losing balance and falling can happen unexpectedly in walking. To propel the body forward in walking, the big toe contributes about 60% of the total power to do so. As the function scan of normal feet in walking on the left shows the most power is exerted under the big toe and the first metatarsal area depicted in red color. Unfortunately, bunion deformity damages this exact function, and the foot has to walk on the second and the third metatarsals instead. That's why the buildup of calluses in that area. To end this talk, I would like to reemphasize that bunion is not a bone but a ligament issue. Bunion is more of a function than a cosmetic problem. Surgery is primarily for restoration of normal walking function of the foot. Thank you for your interest. I hope to see you again in my next bunion talk on the rational surgical treatment of the bunion deformity. Bye-bye for now.